Good morning, my name is Valentin. I'm the founder of Aucteq Biosystems, and we will start the bioreactor revolution. Biological drugs are usually produced in huge bioreactors of several hundred and thousands of liters scale. But to start such a bioreactor, you first have to produce a sufficient amount of cells. And this is currently done by a complex multi-step repotting systems with several bioreactors of increasing size. Once a bioreactor is too small, you have to transfer the cells in a bigger bioreactor and again and again and again. These manual repotting steps induce a high contamination risk, high amount of waste, high working time, and high process cost. But we at Aucteq, we offer a more efficient, a faster, and a safer solution. The first ever highly flexible and expandable bioreactor that grows together with your cells to a volume of 20 liters without manual working steps. And it keeps the cells safe like a womb. Without these manual steps, we have minimal contamination, minimal waste production, minimal process time, and in total we can save at least 30% of the process cost, at least 30%. We filed a PCT patent and we are going to use the Headstart grant to support our patent expenses, but also to drive our product towards serial production and market readiness. Our projected market was in 2017 at a volume of 886 million euros, but it will grow to more than 2.3 billion euros in 2022. And this growth is mainly due to the increased production capacity of biological drugs and biosimilars. We are 3 people. I am responsible for the general management, and I invented the Aucteq bioreactor during my graduate studies in bioprocess development at the University of Applied Sciences Mannheim. And this is where I met Frederick, and he is responsible for research and development, and he is a true genius in the lab. And Karin is our mentor, and she has a strong background in medical device development and holds an MBA. We are well connected to potential customers, for example Roche or Pfizer, and they already expressed huge interest in our product, although we are not even on the market yet. So they support us with their network and invaluable feedback. And we have cooperation partners, for example Cytina. They help us in establishing a distribution network by granting us access to their existing customers. We are also well connected to private and public institutions, for example the Maffinex Gründerverbund or the Life Science Accelerator Baden-Württemberg, and they helped us to become what we are. We are Aucteq Biosystems, and we will start the bioreactor revolution.
Question after, are the cells stay vital? How long are they stay vital?
The cells?
Yes.
They are continuously growing. They are immortal cells, so they stay vital all over the process, depending how long you want to have your process. Yeah.
Okay. What is your scalable model? Thank you.
So this is a single-use product. So after the serial production, we can easily expand the production process by just producing more of them. And then we are planned to enter the German market, then the Austrian, Switzerland market, European market, and then go to United States and later the Asian market. And yeah, we are going to sell the product to hopefully all of the big biotech companies and pharma companies.
Great talk, many thanks. Could you share some thoughts with us about how your idea, your approach fits to the ambitions and goals of EIT Health?
Yeah, so we are in the production process of biological drugs. And we see the future of, for example, cancer therapy or neurodegeneratives in the biological drugs. We help we work in the process. We help to make the process better, to make it more effective, save costs, and finally, hopefully, also to make it faster, easier. Yeah, so it's more in the production of these drugs than finally. Yeah.
So where are you in your development in terms of proof of concept? I would like to understand how it actually works, because you didn't talk too much about the technology.
Yeah, so I have some slides you can maybe, we are in the lab, still in the lab, and we cultured cells, different kind of cell lines, T lymphocyte cell line, but also the CHO cell line in our product, and it works quite well. So our next step is an automated production to get a constant quality of our product, and then we have companies, smaller and bigger companies that want to try it in a test scale, and so these are our next steps then, what we want to do. But first we have to get an automated production. Yeah.
how does this thing grow?
It can be inflated.
Ah, okay,
Yeah.
thank you.
So yeah.
And the real question was, I mean, there are processes established now. How are you going to get a foot in the door?
Yeah, it's funny. In the beginning, we thought it would be difficult, but then when we did our first pitch and just showed problem and the solution slide in a bioprocess summit, then 5 companies came to us and they were users, and they asked if they can already buy the product. At this time, we didn't even have the product, just the idea. Our plan is to get into the companies with tests, like for example a PhD thesis or master thesis, and small amounts, small numbers. And once they have the benefits of our product, they will go in a pilot scale and then in a production scale.
Do you have plans to expand your product range?
To expand, like grow or other products? Yeah. So we currently we are working on a similar technology, not the same bioreactor for the cell line development, and also we plan to induce online monitoring systems, like so you can watch the glucose and lactate and cell growth online without taking samples. And we met here in Headstart already a company that does online monitoring, which was really nice. So these are the future plans then, yes.
I mean, which part of your solution is actually protectable? I mean, the idea is great, but as such, probably hard to protect. So what part is protectable?
So our patent covers the a bioreactor with a highly flexible material. So usually all patents on bioreactors are either glass, stainless steel, or polymers that are not flexible. And so this is how we could patent it. So it's the flexible bioreactor itself, but also then we included the process to expand cell lines by using an expandable bioreactor. And we connected the technology with the process in the patent.
How many of these does a typical customer of yours need per month, per year? And are you going to produce them yourself, or will you partner up with someone?
So in long term, we don't want to produce it on ourselves, so we will contact, or we have already contact to companies with a qualified system. They can produce it in clean room conditions, so we are not going to do it on our own. And second answer is there's not a typical customer. There can be small companies, but also big companies. And for example, a big company like Boehringer Ingelheim, or yes, they have between 5,000 and 10,000 units per year they need.